Hi, my name is Jessica Bass, and this is my informative speech. He was willing to risk it all to help people. By putting himself at risk, Dr. Kent Brantley contracted deadly Ebola virus while providing care in the West African country of Liberia. Dr. Brantley, knowing the risk, cared for patients with the deadly Ebola virus and contracted the virus himself. Although there is no cure for the virus, there is supportive care which can help the patient's body fight the virus and ease symptoms. This is the type of care that Dr. Brantley received while he was brought back to the United States. Now Dr. Brantley and others in the medical community hope to raise awareness about suffering from this virus and research of potential vaccines or ultimately a cure. Dr. Brantley initially went to West Africa as a doctor for a Christian relief organization. Enduring hot temperatures of 115 degrees, Brantley treated his patients in the unfortunate country of Liberia. If having to witness and treat this virus wasn't excruciating enough, Dr. Brantley had to suffer through what his own patients experienced. The Ebola virus hadn't yet infected an American until this year with Brantley's case. This deadly disease originated in 1976 by non-human primates, such as gorillas and apes. It is believed that fruit bats are possible carriers of this disease as well. Ebola spread to the natives of Africa because they used this animal as a source of food, stated in How Ebola Emerged from the Jungle. Anyone handling the butchered meat of a fruit bat that had been infected with the virus could subject themselves to getting it as well. Brantley's compassionate heart of service was and still is undoubtedly needed in Africa. As stated on National Public Radio's website, the hospital at Monrovia, where Dr. Kent treated patients, was the only Ebola treatment center when the disease broke out. When reporting in front of the panel, Brantley said that in the month and a half he was there was only one survivor. Kent confessed that it was very difficult to treat patients because the laboratory he used was not sufficiently staffed, as well as being 45 minutes away. Patients had to wait 24 to 36 hours before receiving their life or death sentence from their blood work. Kent believes that he contracted the disease not in his treatment facility, but possibly in another area of the hospital, such as the emergency room. Bedridden in a foreign country in devastating conditions, the outcome for Brantley didn't look good. Kent had a fever of 105, as well as bloody bodily excretions, a sure sign of internal bleeding. Kent's breathing was also extremely labored, which left him with the terrifying conclusion of death. Alongside Kent was Nancy Reichold, who contracted Ebola while doing mission work as well. Brantley and Reichold are two of 160 healthcare workers that have been infected while treating Ebola. The biggest issue with Ebola continuing to spread and affecting people is because there is currently no cure. With little time to waste and not many options, an experimental vaccine called ZMapp was used on Brantley and Reichold. ZMapp had not been yet used on humans, but was used in treating some monkeys with Ebola. An article on CNN's website written by Dr. Sanjay reveals that Dr. Brantley chivalrously, to say the least, offered the vaccine to Reichold first. Kent knew that he was much younger than Miss Reichold, so she would most likely be in worse condition. Unfortunately, Kent's health quickly took a downward spiral when he began having difficulty breathing. Kent's doctors said they told him his life was coming to an end because his body could no longer fight. Faced with the decision with immense pressure, doctors decided to give the untested vaccine to Dr. Brantley. The ZMapp was flown into Liberia, frozen from sub-zero temperatures, with instructions to let it thaw naturally, which meant that they had no time and they were going to have to wait till it was done thawing. Time meant life or death for Brantley. Soon, Kent's breathing became less labored, his rash disappeared, and his fever subsided. Miraculously, Brant received his dose and made a full recovery. He was even able to take his own shower the next day. Dr. Brantley was flown into Atlanta, Georgia, to Emory University Hospital August 2nd, and Reichold soon followed on August 5th. Both patients finished their doses at the hospital and were discharged. One of Brantley's doctors, Dr. Plyer, made a comment that said, It was prayers and antibodies that saved his life. Kent's recovery gives us hope that we are getting closer to finding a way to treat Ebola. Despite Dr. Brantley's recovery, the drug used on him was extremely experimental. As a result, physicians do not recommend using this to treat people. Physicians must do trial runs in order to foresee any problems before injecting these vaccines into patients. Brantley warns that this is a disease that is a fire straight from the pit of hell. We cannot fool ourselves into thinking that the vast moat of the Atlantic Ocean can keep flames away from our shores. As of right now, Ebola is thought to be spread through the bodily fluids. This is good news because this will not be as devastating as if it were airborne. In order to protect ourselves from this virus, our country must be incredibly mindful of who is entering our country and their condition. Dr. Kent's story is one that is bittersweet. His battle with Ebola shows the miracle of medicines, but also the scary reality that this is a deadly virus threatening our country. Would you have the courage to not only witness the deathly consequences of a terrible disease and those less fortunate, but also experience the nightmare for yourself firsthand? Dr. Brantley's unwavering bravery through his mission work, as well as a patient fighting a horrid disease, was incredible.